I'm Jon Frederickson. I'm a psychotherapist and a psychotherapy teacher who lives in Washington, D.C., in the United States. Um, Obviously, I had been working as a therapist. I had many years of my own personal therapy, found it very useful. It was very helpful with anxiety. And in working with a patient one day, she came in and she was very, very different than she'd been before. She had turned out I asked if anything had happened. She said nothing happened. And I said, did you have a head injury? She said, no. And I said, were you in a car accident? She said, yes. What happened? She said, oh, I was rear-ended. I said, oh, well, then you have a counter-coup injury. That's why you're unable to think and why you're having trouble sleeping. So I said, I've heard of this therapy called neurotherapy. Why don't you see this neurotherapist? So she went and saw this neurotherapist. I'd only read about it. And she came back a week later and she was vastly improved. Uh, and I was so stunned by the improvement, I thought, I have to meet this person. And that began my journey in learning about forms of treatment such as REAC. So as a result of this experience, and I told my friend Monica Uru about this, so she looked into this and learned about REAC. So I travel a lot for teaching, so the next time I was in Italy, I sought out this REAC treatment. And I thought, well, maybe it'll help me, because as a therapist, you always want to function at your best. And I had no idea what to expect, and I tend to be a little skeptical. So I had the treatment, and they applied this thing to your ear, and I thought, well, that's kind of weird. But I thought, well, Monica found it very helpful. So the treatment went over 4 days. Day 1, I noticed nothing. Day 2, I noticed nothing. Day 3, I noticed nothing. Day 4, I suddenly can hardly stay awake. And this is right there, just applying this thing to my ear, right? What is this? I can hardly stay up. It's the strangest form of tiredness. And so then I thought, well, obviously it's having some effect. What could this be? So I completed the treatment, and then I continued the rest of my trip in Europe. So the next day, I had no racing thoughts. None. I'd always had racing thoughts. And I thought to myself, well, this could be placebo effect. I mean, this is a legitimate thing to be concerned about. And it could be just temporary, it could be just something to go away. But then I started teaching again. And I noticed something very different. I'd always had an underlying level of anxiety in my body. I'd been traumatized a lot as a child, vast history of trauma. And although therapy had helped me enormously, and it helped with anxiety, there'd always been this kind of agitation. Even my hands would sort of tremor. But I was totally calm. And as a result, I felt like I had 20 extra IQ points. It was like it was only at that point that I realized I'd been spending a lot of my time just managing my body. And now all of a sudden I didn't have to manage my body. My mind was available to just respond to students. And it was the most extraordinary response to then no longer have this underlying anxiety and to not have racing thoughts and to it was like I felt I got my brain back. Now, part of this was that when I was a child, my father was once quite angry with me and hit me on the head with a hammer. And I think somehow that this treatment actually got my brain back. And when I came home, my wife hugged me and she'd say, what did you do? Because my body felt totally different. She could feel it. She said, I used to feel you on the outside, now it's more like on the inside. So she tried it too, of course. So it was quite striking to me as a psychotherapist, because as psychotherapists, we understand anxiety is a psychological symptom. It has psychological causes, which is true. And then we have psychological treatments for treating anxiety. I've written books on this. I've written chapters on treatment of anxiety. I've helped a lot of therapists get better as therapists helping patients with anxiety. But this really was illuminating for me to think about that sometimes you can have a point of view that's very helpful with anxiety, but what if you're operating at the wrong level, right? Because this really was addressing anxiety really on a much more fundamental physiological level that then created a psychological response. There are some psychological symptoms we can treat on the psychological level, but this really made me rethink when you have psychological symptoms, are they best treated on the psychological level, or do sometimes they have to be treated on a more basic physiological level? So it really opened my eyes to the levels at which we need to intervene and help me become much more open to non-psychological treatments for psychological problems. This doesn't obviate the need for psychological treatment, but it also shows how sometimes treatment that's non-psychological may actually be necessary to allow a psychological treatment to be more effective. So to me, they seem very complementary. So in that way, it was, yeah, it was personally extremely helpful to me. But at the same time, it really helped me become much more flexible in terms of the level at which you might need to work when addressing a symptom like this. And uh, it also helped me see why it is in psychotherapy, like psychotropic drugs oftentimes don't have much impact. We know that psychotropic drugs, about 80% of the effect of a psychotropic drug is actually the placebo effect. But that makes sense because what if this is happening at a level below where medications are helping? So yeah, it was really it's been a very fascinating journey for me to see the impact of the treatment, also to see the impact of treatment on many other patients as well.